Question 1. Benchmark analysis indicates that a health and wellness coach is working with a client who expresses a strong desire to significantly restrict their carbohydrate intake to achieve rapid weight loss. The client appears highly motivated, but has not consulted a healthcare provider about this dietary change. Which of the following approaches best aligns with the principles of health and wellness coaching and the HWCCE framework? Option A. Encourage the client to proceed with their plan, assuring them that their motivation will likely lead to success, and offer to track their progress. Option B. Suggest specific low-carbohydrate food options and meal ideas that the coach has found effective for other clients. Option C. Ask the client to explore their understanding of why they want to restrict carbohydrates, what they hope to achieve, and what potential challenges they foresee, while gently inquiring about their current eating patterns and overall well-being. Option D. Immediately advise the client that such a restrictive diet is unhealthy and recommend they consult a registered dietitian for a meal plan. Correct answer is C. Ask the client to explore their understanding of why they want to restrict carbohydrates, what they hope to achieve, and what potential challenges they foresee, while gently inquiring about their current eating patterns and overall well-being. Explanation. This scenario is professionally challenging because it requires a health and wellness coach to navigate the delicate balance between providing supportive guidance and respecting client autonomy, particularly when a client's stated goals may be misaligned with their underlying health needs or safety. The coach must operate within the defined scope of practice for health and wellness coaching, as established by the Health and Wellness Coach Certifying Examination, HWCCE framework, which emphasizes client-led goal setting and empowerment, rather than directive advice or diagnosis. The correct approach represents best professional practice because it prioritizes the client's self-discovery and agency, which are foundational principles of health and wellness coaching. By asking open-ended questions that encourage the client to explore their motivations, potential barriers, and desired outcomes related to their stated goal, the coach facilitates deeper self-awareness. This aligns with HWCCE guidelines that stress the coach's role as a facilitator of change, not an expert dictating solutions. The coach is empowering the client to identify their own path forward, ensuring that any chosen actions are internally motivated and sustainable. This respects the client's autonomy and promotes long-term adherence to their wellness journey. An incorrect approach that involves directly advising the client to abandon their goal or suggesting specific, prescriptive dietary changes without a referral to a qualified healthcare professional represents a significant ethical and regulatory failure. Health and wellness coaches are not licensed to diagnose, treat, or prescribe medical advice. Such actions would exceed the coach's scope of practice as defined by the HWCCE, potentially leading to harm if the client follows inappropriate advice. This also undermines the client's autonomy by imposing the coach's judgment over the client's own decision-making process. Another incorrect approach, such as immediately referring the client to a medical doctor without first exploring the client's perspective and understanding their goal, might be premature and disempowering. While referrals are crucial when health concerns are outside the coach's purview, a good coach first attempts to understand the client's intent and explore their readiness for change within the coaching relationship. This initial exploration can help determine if a referral is truly necessary or if the client can be supported in refining their goal within the coaching framework. This approach fails to fully leverage the coaching process and may inadvertently signal a lack of confidence in the client's ability to self-direct. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and validate the client's stated goal. 2. Explore the client's motivations, values, and desired outcomes related to the goal using open-ended, powerful questions. 3. Assess the client's readiness for change and identify potential internal and external resources. 4. If and only if the exploration reveals potential health risks, safety concerns, or a need for specialized expertise beyond the coaching scope, then initiate a discussion about referral to appropriate healthcare professionals. 5. Maintain a focus on client empowerment and self-efficacy throughout the process. Question 2. Stakeholder feedback indicates that some clients express significant skepticism and resistance towards incorporating physical activity into their wellness plans, often citing a lack of enjoyment or perceived difficulty. As a health and wellness coach, how should you best address this client sentiment to foster engagement with the benefits of physical activity? Option A. Provide a standardized, high-intensity workout plan that has shown success with other clients, encouraging the client to just try it, and assuring them that they will eventually come to enjoy the process once they see the results. Option B. Engage in a collaborative exploration of the client's personal values, goals, and existing beliefs about physical activity, gently uncovering potential barriers and co-creating strategies that align with their readiness for change and highlight how physical activity can support their desired outcomes. Option C. Directly present a comprehensive list of the scientifically proven health benefits of regular physical activity, emphasizing the severe long-term health risks associated with a sedentary lifestyle to impress upon the client the urgency of adopting an exercise regimen. Option D. Acknowledge the client's feelings of skepticism and agree that physical activity may not be suitable for everyone, shifting the focus to other wellness modalities that the client finds more appealing, without further discussion of physical activity. The correct answer is B. Engage in a collaborative exploration of the client's personal values, goals, and existing beliefs about physical activity, gently uncovering potential barriers and co-creating strategies that align with their readiness for change and highlight how physical activity can support their desired outcomes. Explanation. Scenario analysis. This scenario presents a common challenge for health and wellness coaches, balancing client autonomy with the coach's professional responsibility to provide evidence-based guidance. The client's skepticism towards physical activity, despite its well-documented benefits, requires the coach to employ persuasive yet ethical communication strategies. The challenge lies in respecting the client's current beliefs and readiness for change, while effectively advocating for a behavior that is crucial for their stated wellness goals. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a client-centered, motivational interviewing style. This involves exploring the client's ambivalence, identifying their personal values and goals, and collaboratively exploring how physical activity can serve as a tool to achieve those goals. This aligns with the ethical principles of autonomy and beneficence, empowering the client to make informed decisions about their health. It respects the client's current perspective and builds rapport, which is foundational for effective coaching. The focus is on intrinsic motivation, a key driver for sustainable behavior change, and avoids imposing external judgments or mandates. Incorrect approaches analysis. One incorrect approach involves dismissing the client's concerns and immediately presenting a rigid exercise prescription. This fails to acknowledge the client's current state of readiness and can lead to resistance, damaged rapport, and a breakdown in the coaching relationship. Ethically, it violates the principle of client autonomy by not adequately exploring their perspective and potentially imposing a plan they are not ready to adopt. Another incorrect approach is to simply agree with the client's skepticism and avoid discussing physical activity altogether. This is a failure of professional responsibility and beneficence. While respecting autonomy is important, a health and wellness coach has a duty to provide information and guidance that supports the client's stated wellness goals, especially when those goals are demonstrably linked to evidence-based practices like physical activity. This approach neglects the core purpose of the coaching relationship. A third incorrect approach might involve using guilt or shame to motivate the client, such as highlighting the negative health consequences of inactivity without exploring the client's personal connection to these risks or their potential for positive change. This is ethically unsound and counterproductive, as it can create anxiety and defensiveness rather than fostering intrinsic motivation and self-efficacy. Professional reasoning. Professionals should employ a decision-making process that begins with active listening and empathy to understand the client's perspective. This is followed by a collaborative exploration of the client's goals and values. Evidence-based information about the benefits of physical activity should then be presented in a way that is relevant to the client's individual circumstances and aspirations. The coach should facilitate the client's own discovery of how physical activity can contribute to their well-being, rather than dictating a course of action. This process respects client autonomy while upholding the coach's ethical obligation to promote health and wellness. Question 3. During the evaluation of a new client, Sarah, a health and wellness coach learns that Sarah is enthusiastic about a popular diet trend that significantly restricts carbohydrates. Sarah states she feels more energetic on this diet. The coach's primary goal is to help Sarah achieve sustainable health improvements. Which of the following coaching approaches best aligns with the principles of basic nutrition and the role of a health and wellness coach? Option A. Immediately advise Sarah that a low-carbohydrate diet is generally not sustainable or healthy long-term, and recommend she adopt a balanced macronutrient distribution with moderate carbohydrate intake. Option B. Acknowledge Sarah's positive experience with the diet. Inquire about her understanding of carbohydrates' role in energy and satiety, and explore how this diet aligns with her overall health goals, offering to provide evidence-based information on macronutrient balance. Option C. Validate Sarah's preference for low-carbohydrate eating, emphasizing that personal dietary choices are paramount, and that the coach will support whatever eating pattern Sarah chooses, regardless of its macronutrient balance. Option D. Focus on the macronutrient composition of the diet Sarah is following, explaining the scientific definitions of carbohydrates, proteins, and fats without delving into Sarah's personal experience or goals. The correct answer is B. Acknowledge Sarah's positive experience with the diet. Inquire about her understanding of carbohydrates' role in energy and satiety, and explore how this diet aligns with her overall health goals, offering to provide evidence-based information on macronutrient balance. Explanation. This scenario presents a common challenge for health and wellness coaches, navigating client-driven dietary preferences that may not align with optimal nutritional science. The professional difficulty lies in balancing client autonomy and rapport building with the coach's ethical responsibility to provide evidence-based guidance. The coach must avoid imposing personal beliefs or rigid dietary dogma, while still empowering the client to make informed choices that support their health goals. The correct approach involves a collaborative exploration of the client's current eating habits, understanding the rationale behind their preferences, and then gently introducing evidence-based information about macronutrients and their roles in energy, satiety, and overall health. This approach respects the client's agency, fosters trust, and allows for gradual, sustainable changes. It aligns with the HWCCE emphasis on client-centered coaching and the ethical guidelines that prioritize client well-being and informed decision-making. The coach acts as a facilitator and educator, not a prescriber. An incorrect approach that focuses solely on the client's stated preference without further exploration fails to uphold the coach's duty to provide accurate, evidence-based information. This could lead to the client continuing suboptimal dietary patterns that hinder their progress. Another incorrect approach that immediately dismisses the client's preference and dictates a specific macronutrient ratio without understanding the client's context or goals is overly prescriptive and can damage the coaching relationship, potentially violating ethical principles of respect and autonomy. Third incorrect approach that oversimplifies macronutrient roles without considering the client's individual needs or the broader context of a balanced diet risks providing incomplete or misleading information. Professionals should approach such situations by first actively listening and seeking to understand the client's perspective and motivations. This is followed by a process of psychoeducation, where the coach explains relevant concepts in an accessible manner, empowering the client to integrate this knowledge into their own decision-making. The coach's role is to guide, support, and educate, ensuring that any dietary adjustments are made in a way that is safe, effective, and sustainable for the individual client. Question 4. Strategic planning requires a health and wellness coach to select appropriate assessment tools to gather information for client goal setting. Considering the HWCCE regulatory framework, which of the following approaches best aligns with professional best practices for utilizing assessment tools? Option A. Administer assessments without explicit client consent, assuming clients are aware of and agree to the data collection process as part of engaging a coach. Option B. Prioritize assessment tools that are evidence-based, validated for their intended purpose, and administered with informed client consent, ensuring they align with the coach's scope of practice and HWCCE guidelines. Option C. Utilize a wide variety of free, easily accessible online questionnaires to gather as much information as possible, regardless of their psychometric properties or relevance. Option D. Employ diagnostic psychological assessments to gain a deep understanding of the client's mental health status, even if the coach lacks specific training in clinical psychology. The correct answer is B. Prioritize assessment tools that are evidence-based, validated for their intended purpose, and administered with informed client consent, ensuring they align with the coach's scope of practice and HWCCE guidelines. Explanation. Scenario analysis. This scenario presents a common challenge for health and wellness coaches, selecting appropriate assessment tools to gather client information effectively and ethically. The difficulty lies in balancing the need for comprehensive data with client privacy, the validity and reliability of the tools, and the coach's scope of practice. A coach must ensure that the chosen tools are not only informative, but also ethically administered and interpreted within the bounds of their professional certification. Correct approach analysis. The best professional practice involves selecting assessment tools that are evidence-based, validated for the intended purpose, and aligned with the coach's scope of practice as defined by the Health and Wellness Coach Certifying Examination, HWCCE standards. This means prioritizing tools that have demonstrated reliability and validity in measuring relevant health and wellness constructs. Furthermore, the coach must ensure that the client provides informed consent for the use of these tools, understanding how the data will be collected, stored, and utilized. Adhering to HWCCE guidelines on client confidentiality and data privacy is paramount. The chosen tools should directly support the collaborative goal-setting and action planning process, providing objective data to inform the coaching relationship. Incorrect approach is analysis. One incorrect approach is to rely solely on readily available, unvalidated online questionnaires without assessing their psychometric properties or suitability for the client's specific needs. This fails to meet the HWCCE expectation of using professional and evidence-based tools, potentially leading to inaccurate assessments and ineffective coaching strategies. Ethically, it breaches the duty of care by not employing the best available methods. Another incorrect approach is to use assessment tools that delve into diagnostic or therapeutic areas outside the scope of health and wellness coaching, such as clinical psychological assessments. This oversteps the coach's professional boundaries and could lead to misinterpretation of results or harm to the client if not handled by a qualified mental health professional. This violates HWCCE guidelines regarding scope of practice and potentially leads to practicing outside of one's expertise. A third incorrect approach is to administer assessment without obtaining informed consent or clearly explaining how the data will be used. This is a direct violation of ethical principles related to client autonomy and privacy, and it contravenes HWCCE standards on informed consent and data protection. Clients have a right to know what information is being collected and how it will be managed. Professional reasoning. When selecting assessment tools, a health and wellness coach should employ a systematic decision-making process. This begins with clearly defining the coaching goals and the specific information needed to support them. Next, the coach should research and evaluate available assessment tools based on their evidence base, validity, reliability, and relevance to the client's goals and the coach's scope of practice. The coach must then consider the ethical implications, including client consent, data privacy, and the potential for misinterpretation. Finally, the chosen tools should be integrated into the coaching process in a way that empowers the client and facilitates progress towards their wellness objectives, always in alignment with HWCCE standards. Question 5. The evaluation methodology shows that during a coaching session, a client expresses significant distress about new, persistent physical symptoms and mentions they have not yet seen a doctor. The health and wellness coach is trained to help clients set and achieve wellness goals. Which of the following actions best aligns with the definition and scope of health and wellness coaching? Option A. Advise the client that their concerns are outside the scope of health and wellness coaching and terminate the session promptly to avoid any ethical complications. Option B. Probe further into the nature and duration of the physical symptoms to help the client understand their potential causes before they see a doctor. Option C. Immediately offer specific dietary recommendations that might alleviate the physical symptoms and suggest relaxation techniques to manage the stress associated with them. Option D. Acknowledge the client's distress, validate their feelings, and gently guide the conversation back to the client's established wellness goals, while also suggesting they consider consulting with a healthcare professional about their symptoms. The correct answer is D. Acknowledge the client's distress, validate their feelings, and gently guide the conversation back to the client's established wellness goals, while also suggesting they consider consulting with a healthcare professional about their symptoms. Explanation. This scenario presents a professional challenge because it requires the health and wellness coach to navigate the boundaries of their scope of practice, particularly when a client expresses concerns that may verge on medical or psychological conditions. The coach must exercise careful judgment to ensure they are providing appropriate support without overstepping into the roles of licensed healthcare professionals. The correct approach represents best professional practice because it adheres strictly to the definition and scope of health and wellness coaching, as established by the Health and Wellness Coach Certifying Examination (HWCCE) framework. This framework emphasizes empowering clients to set and achieve their own health and wellness goals through a collaborative, client-driven process. By acknowledging the client's concerns, validating their feelings, and then guiding them back to their own agenda and goals within the coaching context, the coach maintains ethical boundaries. This approach respects the client's autonomy and agency, while ensuring the coach does not provide advice or interventions outside their certified expertise, thereby avoiding potential harm and upholding professional integrity. An incorrect approach that involves offering direct advice on managing the client's reported symptoms or suggesting specific dietary changes to address the symptoms would represent a failure to adhere to the HWCCE scope of practice. Health and wellness coaches are not licensed to diagnose, treat, or prescribe for medical or psychological conditions. Such actions would constitute practicing outside the scope of their certification, potentially leading to adverse health outcomes for the client and violating ethical guidelines that mandate coaches to refer clients to appropriate healthcare professionals when necessary. Another incorrect approach, such as dismissing the client's concerns or immediately ending the session without acknowledging their distress, would be ethically problematic. Coaches must maintain boundaries. Empathy and active listening are crucial components of the coaching relationship. Failing to acknowledge the client's expressed difficulties, even if they fall outside the coaching scope, can damage the rapport and trust essential for effective coaching. It also misses an opportunity to gently guide the client towards seeking appropriate professional help. The professional decision-making process for similar situations should involve a clear understanding of the HWCCE definition and scope of health and wellness coaching. When a client presents with issues that may fall outside this scope, the coach should 1. Listen actively and empathetically to the client's concerns. 2. Acknowledge and validate the client's feelings. 3. Gently reaffirm the coaching focus on client-driven goals and the coach's role. 4. If the concerns appear to be medical or psychological in nature, clearly and compassionately suggest the client consult with a qualified healthcare professional. 5. Support the client in identifying their own next steps, which may include seeking such professional consultation. This process ensures the coach remains within their ethical and professional boundaries while providing supportive guidance. Question 6. Regulatory review indicates that effective health and wellness coaching involves identifying both client strengths and potential barriers to achieving goals. A client states, "I'm really good at planning my meals, that's my strength, and I want to lose 10 pounds. Which of the following coaching approaches best facilitates the client's self-discovery regarding this goal? Option A. Acknowledge the client's strength in meal planning and ask, how do you envision using your meal planning skills to support your weight loss goal and what might get in the way of that? Option B. Directly ask the client, what are your biggest challenges with sticking to a diet and how can I help you overcome them? Option C. Congratulate the client on their meal planning strength and suggest, to lose 10 pounds, you should focus on portion control and avoid processed foods. Option D. Affirm the client's meal planning strength and state, that's a great strength to have for weight loss. You'll likely achieve your goal easily. The correct answer is A. Acknowledge the client's strength in meal planning and ask, how do you envision using your meal planning skills to support your weight loss goal and what might get in the way of that? Explanation. This scenario presents a common challenge for health and wellness coaches, balancing a client's expressed desires with their underlying, potentially unacknowledged barriers. The professional challenge lies in moving beyond surface-level statements to facilitate deeper self-awareness and effective goal setting. A health and wellness coach must operate within the ethical guidelines and scope of practice defined by their certifying body, which emphasizes client autonomy and empowerment, while also ensuring the coach does not overstep into therapeutic territory. The correct approach represents best professional practice because it directly addresses the client's stated strength while gently probing for potential obstacles. This aligns with the HWCCE emphasis on client-centered coaching, where the coach acts as a facilitator of self-discovery. By asking an open-ended question that connects the strength to the goal, the coach encourages the client to reflect on how they might leverage that strength to overcome anticipated difficulties. This fosters a collaborative partnership and promotes sustainable change by acknowledging both internal resources and potential challenges. An incorrect approach that focuses solely on the client's stated strength without exploring potential barriers fails to fully support the client's progress. This could lead to the client encountering unforeseen obstacles and becoming discouraged, potentially undermining the coaching relationship and the client's confidence. Ethically, this approach might be seen as not providing comprehensive support within the coach's scope. Another incorrect approach that immediately attempts to fix or solve the perceived barrier rather than allowing the client to explore it oversteps the coaching role. This can disempower the client, foster dependency, and potentially lead the coach into areas requiring specialized therapeutic expertise, which is outside the HWCCE-defined scope of practice. This constitutes an ethical failure by not respecting client autonomy and by potentially practicing outside one's competency. A professional decision-making framework for such situations involves active listening to identify both explicit statements and implicit concerns. The coach should then use powerful, open-ended questions to encourage client reflection, validate the client's strengths, and collaboratively explore potential barriers. The focus remains on empowering the client to find their own solutions, with the coach providing support and accountability within their defined professional boundaries. Question 7. The performance metrics show a consistent decline in a client's engagement with their wellness plan and a reported increase in fatigue during recent sessions. When the coach gently probes about potential stressors, the client deflects the conversation, stating they are fine and prefer to focus on the established plan. What is the most appropriate course of action for the health and wellness coach in this situation? Option A. Continue with the existing wellness plan, assuming the client is capable of managing their own stress and that their current state is temporary. Option B. Directly inform the client that their current stress levels are likely impacting their progress and prescribe specific breathing exercises and mindfulness techniques. Option C. Acknowledge the client's statement while gently expressing concern about the observed changes and offering to explore what might be contributing to their feelings when they feel ready. Option D. Immediately refer the client to a licensed therapist or counselor, stating that their current state is beyond the scope of health and wellness coaching. The correct answer is C. Acknowledge the client's statement while gently expressing concern about the observed changes and offering to explore what might be contributing to their feelings when they feel ready. Explanation. This scenario presents a professional challenge because the health and wellness coach is observing a client's potential decline in well-being, which could be linked to stress, but the client is resistant to discussing it. The coach must balance the ethical obligation to support the client's health with the client's autonomy and right to self-determination. The coach also needs to consider the scope of practice and avoid overstepping into areas requiring medical or psychological diagnosis. The correct approach represents best professional practice because it prioritizes a client-centered, empathetic, and non-judgmental exploration of the client's experience. By gently inquiring about the client's feelings and offering support without imposing solutions, the coach respects the client's pace and readiness to engage. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, by not pushing the client into uncomfortable territory, while still opening the door for future discussion and support. It also adheres to the principle of autonomy by allowing the client to control the direction of the coaching relationship. An incorrect approach that involves directly diagnosing the client's stress or prescribing specific stress management techniques without the client's explicit engagement is a regulatory and ethical failure. This constitutes practicing outside the scope of a health and wellness coach, potentially misinterpreting symptoms, and imposing uninvited advice, which can erode trust and be counterproductive. Another incorrect approach, such as immediately referring the client to a mental health professional without first attempting to understand the client's perspective or offering initial support, might be premature and could make the client feel misunderstood or abandoned, failing the principle of providing appropriate support within the coaching relationship. A third incorrect approach, ignoring the observed changes and continuing with the established plan without any acknowledgement of the client's potential distress, is an ethical failure to uphold the duty of care and to be attentive to the client's evolving needs. Professionals should use a decision-making framework that begins with careful observation and active listening. When concerns arise, the next step is to create a safe space for the client to share their experiences. This involves open-ended questions and empathetic validation. If the client remains hesitant, The coach should respect their boundaries while gently reiterating their availability to discuss concerns when the client feels ready. If the observed issues appear to be beyond the scope of coaching, a referral to an appropriate professional should be considered, but only after an attempt to understand the client's situation and with the client's consent. Question 8. Cost-benefit analysis shows that addressing micronutrient deficiencies can significantly improve overall health and energy levels. A client informs their health and wellness coach that they have recently been diagnosed with a mild iron deficiency by their physician and are awaiting a follow-up appointment to discuss treatment options. The client asks the coach for advice on what specific supplements they should start taking immediately to boost their iron levels. What is the most appropriate course of action for the health and wellness coach in this situation? Option A. Suggest the client focus on increasing their intake of iron-rich foods through general dietary advice and disregard the diagnosed deficiency for now. Option B. Provide a detailed meal plan specifically designed to correct the iron deficiency without consulting the client's physician. Option C. Recommend a specific over-the-counter iron supplement and dosage based on general recommendations for iron deficiency. Option D. Advise the client to discuss their iron deficiency and potential supplementation strategies with their physician or a registered dietitian at their upcoming appointment. The correct answer is D. Advise the client to discuss their iron deficiency and potential supplementation strategies with their physician or a registered dietitian at their upcoming appointment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the health and wellness coach to navigate the complex interplay between general health advice and specific nutritional recommendations, particularly when a client presents with a diagnosed deficiency. The coach must balance the scope of their practice with the need for accurate, evidence-based guidance, while also respecting the client's autonomy and the roles of other healthcare professionals. The challenge lies in providing supportive and informative guidance without overstepping professional boundaries or offering medical advice. Correct approach analysis. The correct approach represents best professional practice because it prioritizes client safety and well-being by acknowledging the diagnosed micronutrient deficiency and recommending consultation with a qualified healthcare provider. This aligns with the ethical guidelines of the Health and Wellness Coach Certifying Examination, HWCCE, which emphasize operating within one's scope of practice and referring clients to appropriate medical professionals when necessary. The HWCCE framework stresses that health and wellness coaches are not medical practitioners and should not diagnose or treat medical conditions. By suggesting the client discuss their deficiency and potential supplementation with their physician or a registered dietitian, the coach ensures the client receives expert medical advice tailored to their specific needs, thereby upholding professional integrity and client welfare. Incorrect approaches analysis. One incorrect approach involves the coach immediately recommending specific over-the-counter supplements without consulting the client's physician. This is a regulatory and ethical failure because it constitutes practicing outside the scope of a health and wellness coach, potentially leading to inappropriate or harmful supplementation. The HWCCE framework prohibits coaches from providing medical advice or prescribing treatments. Another incorrect approach is to dismiss the deficiency as minor and advise the client to focus solely on general dietary improvements. This fails to acknowledge the seriousness of a diagnosed deficiency and the potential need for targeted intervention, which could be a violation of the coach's duty of care and a disregard for evidence-based health practices. Finally, an incorrect approach would be to provide detailed meal plans designed to specifically correct the deficiency without the input of a registered dietitian or physician. This again crosses the boundary into medical nutrition therapy, which is outside the purview of a health and wellness coach, and could lead to adverse health outcomes if not properly managed by a qualified professional. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the client's stated needs and any existing medical diagnoses. They must then assess whether the request falls within their defined scope of practice and ethical guidelines. If the request involves medical diagnosis, treatment, or specific nutritional therapy for a diagnosed condition, the professional's primary responsibility is to refer the client to an appropriate licensed healthcare provider. This involves clearly communicating the referral and the reasons for it, while continuing to offer support within their coaching capacity. Continuous professional development and a strong understanding of ethical boundaries are crucial for making sound judgments in such situations. Question 9. Implementation of motivational interviewing principles by a health and wellness coach working with a client struggling with weight management involves actively listening to the client's concerns about their eating habits and exercise routines. When the client expresses frustration about past failed attempts at dieting, what is the most appropriate initial coaching response according to the HWCCE regulatory framework? Option A. Share personal stories about your own successful weight loss journey and the strategies you employed. Option B. Directly advise the client on the specific dietary changes and exercise routines they must implement to achieve their weight loss goals. Option C. Ask open-ended questions to explore the client's feelings about their past experiences and what they learned from them, reflecting back their statements to encourage further elaboration. Option D. Immediately provide a detailed, step-by-step meal plan and exercise regimen that has been successful for other clients. The correct answer is C. Ask open-ended questions to explore the client's feelings about their past experiences and what they learned from them, reflecting back their statements to encourage further elaboration. Explanation. This scenario presents a common challenge for health and wellness coaches, balancing client autonomy with the coach's expertise and ethical obligations. The professional challenge lies in discerning when to offer direct advice versus when to employ client-centered motivational interviewing techniques to facilitate self-discovery and intrinsic motivation. Careful judgment is required to avoid imposing personal beliefs or recommendations that could undermine the client's agency or lead to disengagement. The correct approach represents best professional practice because it adheres to the core principles of motivational interviewing, which are foundational to ethical and effective health and wellness coaching as outlined by the HWCCE regulatory framework. This approach prioritizes the client's self-determination and empowers them to explore their own motivations and solutions. By asking open-ended questions and reflecting the client's statements, the coach fosters a collaborative partnership, which is essential for building rapport and facilitating sustainable behavior change. This aligns with the HWCCE emphasis on client-centered care and evidence-based coaching practices. An incorrect approach that involves the coach immediately offering a detailed plan of action fails to respect the client's autonomy. This can be perceived as directive and may lead to resistance or a lack of commitment from the client, as the plan is not rooted in their own identified needs or motivations. Ethically, this approach bypasses the crucial process of collaborative goal setting and can be seen as an overreach of the coach's role, potentially leading to a breach of trust. Another incorrect approach, which involves the coach sharing personal anecdotes of their own weight loss journey, is also professionally unacceptable. While well-intentioned, this shifts the focus from the client to the coach and can inadvertently imply that the coach's experience is a universal solution. This can undermine the client's confidence in their own ability to find their unique path and may violate the principle of maintaining professional boundaries. The HWCCE framework emphasizes that coaching is about facilitating the client's journey, not about the coach's personal experiences. A third incorrect approach, which involves the coach directly telling the client what they should do to lose weight, is a clear violation of motivational interviewing principles and ethical coaching standards. This directive approach disempowers the client, negates their autonomy, and can create a dependency on the coach for direction. It fails to explore the client's readiness for change or their internal motivations, which are critical for long-term success. The HWCCE mandates that coaches support clients in developing their own strategies and solutions. The professional decision-making process for similar situations should involve a conscious application of motivational interviewing principles. First, the coach should actively listen to the client's concerns and aspirations. Second, they should use open-ended questions to explore the client's perspective, values, and motivations. Third, they should practice reflective listening to ensure understanding and to help the client hear their own thoughts and feelings. Fourth, they should summarize key points to reinforce progress and identify areas for further exploration. Finally, the coach should collaborate with the client to identify potential next steps that are aligned with the client's goals and readiness for change, always respecting their autonomy and self-efficacy. Question 10. Risk assessment procedures indicate that a new client is highly motivated to begin an intense, high-impact exercise program immediately to achieve rapid results, but has not undergone any recent health screening or exercise-specific evaluation. What is the most appropriate initial course of action for the health and wellness coach? Option A. Conduct a comprehensive health and fitness assessment, including a review of the client's medical history, current physical capabilities, and any known limitations, before designing any exercise program. Option B. Immediately design a challenging exercise program that matches the client's stated intensity goals to capitalize on their high motivation. Option C. Gently discourage the client from pursuing such an intense program, suggesting they start with very light activities to avoid potential discouragement. Option D. Advise the client to consult a physician for a general health checkup, and then proceed with the client's desired intense program. The correct answer is A. Conduct a comprehensive health and fitness assessment, including a review of the client's medical history, current physical capabilities, and any known limitations, before designing any exercise program. Explanation. This scenario presents a common challenge for health and wellness coaches, balancing client enthusiasm with the need for safety and appropriate scope of practice. The client's eagerness to begin a new, intense exercise program without a prior assessment highlights the potential for injury and the coach's responsibility to act as a gatekeeper for safe progression. The coach must navigate the client's motivation while adhering to established professional guidelines and ethical obligations to prevent harm. The correct approach represents best professional practice because it prioritizes client safety and adheres to the foundational principles of health and wellness coaching, which are implicitly guided by a duty of care. This involves a systematic risk assessment that aligns with the Health and Wellness Coach Certifying Examination (HWCCE) framework, which emphasizes evidence-based practices and client well-being. A thorough assessment allows the coach to identify contraindications, limitations, and appropriate starting points, ensuring the exercise program is tailored to the client's current fitness level and health status. This proactive measure is crucial for preventing injuries, managing expectations, and building a trusting coach-client relationship based on responsible guidance. An incorrect approach that involves immediately designing a high-intensity program without a proper assessment fails to uphold the coach's ethical responsibility to do no harm. This could lead to acute injuries, exacerbation of pre-existing conditions, and a negative impact on the client's overall health journey, potentially resulting in legal repercussions and damage to the coaching profession's reputation. Another incorrect approach, such as dismissing the client's concerns about intensity and proceeding without further inquiry, demonstrates a lack of professional diligence and in disregard for the client's subjective experience and potential underlying issues. This can erode trust and lead to a breakdown in the coaching relationship. Finally, an approach that involves referring the client to a medical professional for a general clearance without conducting any specific exercise-related risk assessment by the coach would be incomplete. While medical clearance is often a necessary step, the coach's role includes a specific assessment of exercise-related risks within their scope of practice. Professionals should employ a decision-making framework that begins with a comprehensive understanding of their scope of practice and ethical obligations. This involves a systematic process of information gathering, including client history, current health status, and lifestyle factors. When physical activity is involved, a structured risk assessment is paramount. This assessment should inform the development of a safe and effective plan, with clear communication and collaboration with the client. If the assessment reveals any red flags or areas outside the coach's expertise, a referral to an appropriate healthcare professional is the next responsible step. The overarching principle is to always prioritize client safety and well-being within the bounds of professional competence. Question 11. Governance review demonstrates that a health and wellness coach is preparing to conduct an initial client assessment. The client has expressed a desire to focus solely on nutrition and exercise. The coach, however, recognizes that a comprehensive assessment should also explore stress management, sleep patterns, and social support systems, as these are interconnected with overall well-being. Which approach best aligns with professional standards and ethical practice for conducting this health and wellness assessment? Option A. The coach explains to the client why exploring stress management, sleep patterns, and social support is important for their overall wellness goals, detailing how these areas can impact nutrition and exercise outcomes, and seeks the client's informed consent to include these components in the assessment. Option B. The coach proceeds with a nutrition and exercise-focused assessment only, as per the client's explicit request, to ensure client satisfaction and avoid potential conflict. Option C. The coach focuses primarily on nutrition and exercise, but briefly mentions that other areas like stress and sleep are also important, without delving into the specifics or seeking explicit consent for their inclusion. Option D. The coach unilaterally includes all potential assessment components, including stress, sleep, and social support, without fully explaining their relevance to the client's stated goals, assuming the client will understand the necessity. The correct answer is A. The coach explains to the client why exploring stress management, sleep patterns, and social support is important for their overall wellness goals, detailing how these areas can impact nutrition and exercise outcomes, and seeks the client's informed consent to include these components in the assessment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the health and wellness coach to balance the client's stated preferences with the coach's professional responsibility to conduct a comprehensive and evidence-based assessment. The coach must navigate potential client resistance to certain assessment components while ensuring the assessment effectively identifies all relevant health and wellness factors. This requires strong communication, ethical judgment, and an understanding of the scope of practice. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a holistic and client-centered assessment that adheres to established health and wellness coaching standards. By explaining the rationale behind each assessment component and seeking the client's informed consent, the coach demonstrates transparency and respects client autonomy. This aligns with ethical guidelines that mandate comprehensive client evaluation and informed participation, ensuring the assessment is both effective and respectful. Incorrect approaches analysis. One incorrect approach fails to adequately explain the purpose of certain assessment components, potentially leading to client misunderstanding or distrust. This can undermine the client's engagement and the validity of the assessment, violating the ethical principle of informed consent and potentially falling short of the comprehensive assessment requirements. Another incorrect approach might involve the coach making assumptions about the client's needs without a thorough assessment, or conversely, rigidly adhering to a predefined checklist without considering the client's unique circumstances. This can lead to an incomplete or irrelevant assessment, failing to identify critical areas for improvement and potentially misdirecting the coaching process. It also risks overstepping the coach's scope of practice by making diagnostic judgments. A further incorrect approach could involve the coach prioritizing speed or convenience over thoroughness, skipping essential assessment steps. This directly contravenes the professional obligation to conduct a comprehensive evaluation and could lead to missed opportunities for intervention or even harm if underlying issues are not identified. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the client's goals and current situation. This is followed by identifying the most appropriate and comprehensive assessment tools and methods that align with professional standards and ethical guidelines. Crucially, this framework involves transparent communication with the client about the assessment process, its purpose, and the expected outcomes, ensuring informed consent and active participation. The coach must then critically analyze the assessment data, integrating it with the client's input to develop a personalized and effective wellness plan. Question 12. The efficiency study reveals that a client consistently struggles to incorporate recommended dietary changes into their daily routine, citing a lack of understanding of how to translate general dietary guidelines into practical, everyday meals that align with their cultural preferences and busy lifestyle. As a health and wellness coach, what is the most appropriate course of action? Option A. Advise the client to simply follow their current eating habits more closely, as personal preference should always dictate dietary choices, regardless of established health recommendations. Option B. Collaborate with the client to adapt general, evidence-based dietary guidelines into personalized meal suggestions that consider their cultural background, food availability, and time constraints, while educating them on the principles behind these recommendations. Option C. Recommend that the client consult a registered dietitian for all dietary advice, disengaging from any further discussion on nutrition to avoid potential liability. Option D. Provide the client with a rigid, pre-designed meal plan based on a popular but potentially restrictive fad diet, assuming this will force adherence and yield rapid results. The correct answer is B. Collaborate with the client to adapt general, evidence-based dietary guidelines into personalized meal suggestions that consider their cultural background, food availability, and time constraints, while educating them on the principles behind these recommendations. Explanation: the efficiency study reveals that a significant portion of clients are not adhering to recommended dietary patterns. This scenario is professionally challenging because health and wellness coaches must balance providing evidence-based guidance with respecting client autonomy and individual circumstances. It requires careful judgment to ensure recommendations are both effective and appropriate for each client's unique needs and cultural background, while remaining within the scope of practice and adhering to established dietary guidelines. The correct approach represents best professional practice because it prioritizes client-centered care and evidence-based recommendations aligned with recognized dietary guidelines. By referencing and adapting general dietary guidelines to individual needs, the coach ensures that the advice is safe, effective, and culturally sensitive. This approach upholds ethical principles of beneficence and non-maleficence, ensuring the client receives appropriate support without overstepping professional boundaries or providing unsubstantiated advice. It also aligns with the principles of the Health and Wellness Coach Certifying Examination, HWCCE, which emphasizes the coach's role in facilitating client behavior change based on established health principles. An incorrect approach that involves providing a highly restrictive, fad diet-based meal plan fails to adhere to general dietary guidelines and may be detrimental to the client's health. This could lead to nutritional deficiencies, disordered eating patterns, and a breach of professional ethics by offering advice outside the scope of evidence-based practice. Another incorrect approach, such as solely relying on the client's anecdotal preferences without cross-referencing established dietary guidelines, risks promoting unhealthy habits and neglecting crucial nutritional needs. This demonstrates a lack of professional diligence and could result in adverse health outcomes. Finally, an approach that dismisses the client's dietary concerns and rigidly enforces generic guidelines without exploration of underlying barriers ignores the client's lived experience and the complexities of behavior change, potentially damaging the coaching relationship and hindering progress. This approach fails to acknowledge the individualized nature of health and wellness coaching. Professionals should employ a decision-making framework that begins with understanding the client's current situation, including their dietary habits, preferences, and any barriers they face. This is followed by referencing and applying established, evidence-based dietary guidelines relevant to the client's health goals and demographic. The coach then collaborates with the client to adapt these guidelines into personalized, actionable strategies that respect individual needs and preferences. Continuous assessment and adjustment of the plan based on client feedback and progress are crucial. This process ensures that the coaching is both effective and ethically sound, grounded in scientific evidence and client-centered principles. Question 13. Investigation of the most appropriate method for a health and wellness coach to evaluate a client's progress towards their stated goals, considering the client's subjective experience and observable behavioral changes within the regulatory framework of the Health and Wellness Coach Certifying Examination, HWCCE. Option A. Administering a validated psychological diagnostic inventory to identify underlying mental health conditions contributing to the client's challenges. Option B. Relying solely on objective biometric data, such as heart rate variability and sleep patterns, without incorporating the client's personal reflections. Option C. The coach's personal assessment of the client's overall improvement based on their intuition and the coach's own definition of success. Option D. A combination of client self-report questionnaires on well-being and goal attainment, alongside the coach's observational notes on behavioral shifts and adherence to agreed-upon strategies. Correct answer is D. A combination of client self-report questionnaires on well-being and goal attainment, alongside the coach's observational notes on behavioral shifts and adherence to agreed-upon strategies. Explanation: this scenario presents a professional challenge because a health and wellness coach must navigate the ethical imperative of client autonomy and informed consent, while also ensuring that the evaluation methods used are appropriate, evidence-based, and do not overstep professional boundaries or create undue client anxiety. The coach must select an evaluation technique that provides meaningful insight into the client's progress without being overly intrusive or misinterpreting data. The correct approach represents best professional practice because it prioritizes a holistic and client-centered evaluation that aligns with the principles of health and wellness coaching. Utilizing a combination of self-report measures and behavioral observation allows for a comprehensive understanding of the client's subjective experience and objective actions. This approach respects the client's agency in reporting their own progress and feelings, while the coach's observations provide an external perspective. This aligns with the HWCCE emphasis on evidence-based practice and client empowerment, ensuring that evaluations are relevant to the client's stated goals and contribute to a collaborative coaching relationship. The focus is on progress and growth, not solely on diagnostic labeling or clinical assessment, which falls outside the scope of a health and wellness coach. An incorrect approach that relies solely on standardized psychological assessment without proper training or referral is a significant ethical and regulatory failure. Health and wellness coaches are not licensed psychologists or medical professionals and are not qualified to administer or interpret such tools. Doing so constitutes practicing outside the scope of their certification and could lead to misdiagnosis, inappropriate interventions, and harm to the client. This violates the HWCCE guidelines on professional boundaries and scope of practice. Another incorrect approach that focuses exclusively on quantitative data without considering the client's qualitative experience is also professionally deficient. While quantitative data can be useful, it often fails to capture the nuances of a client's journey, their emotional state, or the contextual factors influencing their behavior. This can lead to an incomplete or misleading picture of progress and may alienate the client by not acknowledging their lived experience. This approach neglects the relational aspect of coaching and the importance of understanding the client's personal narrative. A third incorrect approach that involves imposing the coach's own subjective interpretation of progress without client input or objective measures is also problematic. This can lead to biased evaluations and a disconnect between the coach's perception and the client's reality. It undermines the collaborative nature of coaching and can erode trust. The HWCCE emphasizes client-driven goals and self-efficacy, which are hindered when the coach unilaterally dictates what constitutes progress. The professional decision-making process for similar situations should involve a clear understanding of the HWCCE scope of practice and ethical guidelines. Professionals should first identify the client's goals and desired outcomes. Then, they should consider evaluation methods that are appropriate for a health and wellness coaching context, prioritizing those that are client-centered, evidence-informed, and respect client autonomy. If a situation requires assessment or intervention beyond the coach's scope, the professional must ethically and competently refer the client to an appropriate healthcare provider. Continuous self-reflection on one's own competencies and limitations is also crucial. Question 14. What factors determine a health and wellness coach's appropriate response when a client expresses a desire to use a specific dietary supplement for a diagnosed health condition? Option A. The coach's understanding of their scope of practice, ethical guidelines, and the imperative to refer clients to qualified healthcare professionals for medical advice. Option B. The availability of general information about the supplement on the internet and the coach's ability to summarize it. Option C. The coach's assessment of the client's financial ability to purchase the supplement. Option D. The coach's personal experience with the supplement and their belief in its effectiveness for similar conditions. The correct answer is A. The coach's understanding of their scope of practice, ethical guidelines, and the imperative to refer clients to qualified healthcare professionals for medical advice. Explanation. Scenario analysis. A health and wellness coach is presented with a client who expresses a desire to use a specific dietary supplement for a serious health condition. The coach must navigate the ethical and regulatory boundaries of their scope of practice, particularly concerning the provision of medical advice or endorsement of treatments for diagnosed conditions. This scenario is professionally challenging because it requires the coach to balance client autonomy and their desire for support with the coach's responsibility to operate within their defined competencies and avoid actions that could be construed as practicing medicine without a license or providing unsubstantiated health claims. The potential for harm to the client if the supplement is ineffective or interacts negatively with other treatments necessitates careful judgment. Correct approach analysis. The correct approach emphasizes the coach's role in facilitating client self-discovery and empowering them to make informed decisions, while strictly adhering to their scope of practice. This involves guiding the client to consult with qualified healthcare professionals for medical advice and treatment recommendations, especially concerning diagnosed health conditions and the use of supplements. This aligns with the core competencies of health and wellness coaching, which include establishing a trusting relationship, active listening, powerful questioning, and client-centered goal setting, all within the framework of not providing medical advice. The regulatory framework for health and wellness coaching, as understood within the context of the HWCCE, mandates that coaches operate within their expertise and refer clients to appropriate medical professionals for diagnosis, treatment, and management of health conditions. Incorrect approaches analysis. An incorrect approach would involve the coach directly recommending or endorsing the supplement, or providing specific advice on its dosage or efficacy for the diagnosed condition. This constitutes practicing medicine without a license and exceeds the coach's scope of practice, violating ethical guidelines and potentially regulatory statutes that define the boundaries between health coaching and medical practice. Another incorrect approach would be to dismiss the client's interest in the supplement without exploring their motivations or concerns, which fails to uphold the core competency of building rapport and supporting client autonomy. A third incorrect approach would be to provide general information about supplements without context or qualification, which could still be misinterpreted as endorsement or advice, and fails to adequately address the client's specific health condition. Professional reasoning. Professionals should employ a decision-making process that prioritizes client safety and adherence to their scope of practice. This involves 1. Actively listening to the client's expressed needs and desires. 2. Acknowledging the client's interest without judgment. 3. Clearly defining the coach's role and limitations, particularly regarding medical advice. 4. Empowering the client to seek information and guidance from qualified healthcare providers for medical conditions and treatment decisions. 5. Collaborating with the client to integrate recommendations from healthcare professionals into their wellness plan within the coach's purview. Question 15. When evaluating a client's request for a highly restrictive, rapid weight loss diet plan, which of the following best reflects the ethical and professional responsibilities of a health and wellness coach operating under the HWCCE framework? Option A. Collaboratively explore the client's motivations and readiness for change, educate them on balanced nutrition and sustainable behavioral strategies, and co-create a personalized plan that prioritizes their overall well-being and long-term health. Option B. Immediately implement the client's requested restrictive diet plan to demonstrate responsiveness to their stated desires and facilitate rapid initial results. Option C. Advise the client that their requested diet is unhealthy and refuse to coach them further, as it falls outside the coach's scope of practice. Option D. Agree to the client's restrictive diet plan, assuming they have researched it thoroughly and are aware of the potential risks. The correct answer is A. Collaboratively explore the client's motivations and readiness for change, educate them on balanced nutrition and sustainable behavioral strategies, and co-create a personalized plan that prioritizes their overall well-being and long-term health. Explanation. This scenario presents a professional challenge because the health and wellness coach must balance the client's stated desire for rapid weight loss with the ethical imperative to promote sustainable and healthy behavioral change. The client's insistence on an extreme dietary approach, while potentially offering quick results, carries significant health risks and is unlikely to foster long-term adherence. The coach's role is not to dictate a diet, but to guide the client in developing a personalized, evidence-based strategy that aligns with their values and capabilities, while prioritizing their well-being. The correct approach represents best professional practice because it prioritizes client autonomy and evidence-based strategies. A health and wellness coach, operating within the scope of practice for the Health and Wellness Coach Certifying Examination, HWCCE, is trained to facilitate client-driven goal setting and behavioral change. This involves exploring the client's motivations, understanding their readiness for change, and collaboratively developing a plan that is realistic, sustainable, and addresses potential barriers. It emphasizes education on balanced nutrition and gradual habit formation, which are core tenets of effective health coaching. This approach respects the client's agency while ensuring the guidance provided is safe and promotes holistic well-being, aligning with ethical guidelines that mandate coaches to act in the best interest of their clients and to practice within their scope. An incorrect approach that focuses solely on the client's immediate demand for a restrictive diet fails to uphold professional responsibility. This would be a regulatory and ethical failure because it could lead to adverse health outcomes, such as nutrient deficiencies, disordered eating patterns, or metabolic disturbances, without adequate consideration of the client's overall health status or the long-term sustainability of such a drastic measure. It also oversteps the coach's scope of practice by implicitly endorsing a specific, potentially harmful, dietary regimen without proper medical or nutritional assessment, which is typically the domain of registered dietitians or medical professionals. Another incorrect approach that involves simply agreeing to the client's extreme plan without further exploration or education is also professionally unacceptable. This demonstrates a lack of critical judgment and a failure to apply coaching principles. Ethically, it neglects the coach's duty to educate and empower the client with knowledge about healthy eating and sustainable lifestyle changes. It also risks reinforcing unhealthy attitudes towards food and weight, potentially contributing to a cycle of yo-yo dieting and negative body image. A professional decision-making process for similar situations involves a structured, client-centered approach. First, actively listen to and acknowledge the client's goals and motivations. Second, explore the underlying reasons for their desired approach, including any past experiences or beliefs about weight loss. Third, educate the client on the principles of healthy eating and sustainable behavioral change, highlighting the potential risks and benefits of various strategies, including their proposed extreme diet. Fourth, collaboratively assess the client's readiness for change and identify potential barriers. Fifth, co-create a personalized plan that is evidence-based, realistic, and aligned with the client's values and capabilities, while always respecting the boundaries of the coaching scope of practice and referring to other healthcare professionals when necessary. Question 16. The assessment process reveals a client who expresses significant interest in a popular detox diet they saw advertised online, citing a desire for rapid weight loss and increased energy. The client has a history of yo-yo dieting. As a health and wellness coach, what is the most appropriate initial response to support the client's goals while adhering to professional standards? Option A. Recommend that the client immediately consult with their physician to discuss the detox diet and any potential health risks, without offering any further nutritional education or support from the coaching perspective. Option B. Enthusiastically endorse the detox diet, providing the client with a sample meal plan based on its advertised principles to help them achieve rapid weight loss and increased energy. Option C. Advise the client that detox diets are generally ineffective and potentially harmful, and strongly discourage them from pursuing it without offering any alternative strategies or support. Option D. Explore the client's motivations for seeking a detox diet, discuss the principles of balanced nutrition, and explain the importance of evidence-based approaches to health, while also suggesting a referral to a registered dietitian for personalized medical nutrition therapy if they wish to pursue specific dietary changes. The correct answer is D. Explore the client's motivations for seeking a detox diet, discuss the principles of balanced nutrition, and explain the importance of evidence-based approaches to health, while also suggesting a referral to a registered dietitian for personalized medical nutrition therapy if they wish to pursue specific dietary changes. Explanation. The assessment process reveals a client with a history of restrictive dieting and a current interest in a popular, unverified detox diet. This scenario is professionally challenging because it requires the health and wellness coach to navigate the client's potentially unhealthy relationship with food, the allure of quick fixes, and the need to provide evidence-based nutritional guidance without overstepping professional boundaries or providing medical advice. The coach must prioritize the client's long-term well-being and adherence to established nutritional principles over potentially harmful fads. The correct approach represents best professional practice because it aligns with the ethical and regulatory guidelines for health and wellness coaches, which emphasize providing education based on scientific evidence and referring to qualified healthcare professionals when necessary. This approach respects the client's autonomy while ensuring their safety and promoting sustainable, healthy habits. It avoids making definitive diagnoses or prescribing specific dietary interventions, which are outside the scope of practice for a health and wellness coach. An incorrect approach that involves recommending the detox diet without critical evaluation or referral fails to uphold the principle of evidence-based practice. This could lead to the client adopting unhealthy eating patterns, experiencing nutrient deficiencies, or developing a further disordered relationship with food. Ethically, it is a failure to protect the client's well-being. Another incorrect approach, which is to dismiss the client's interest in the detox diet outright without exploring their motivations or providing alternative, evidence-based information, can alienate the client and damage the coaching relationship. While not directly harmful, it misses an opportunity for education and support, potentially leading the client to seek advice from less qualified sources. A third incorrect approach, which is to provide a detailed meal plan based on the detox diet's principles, crosses the boundary into medical nutrition therapy. This is a regulated practice that requires a licensed dietitian or nutritionist. A health and wellness coach providing such a plan would be acting outside their scope of practice and potentially violating regulations. The professional reasoning process for similar situations should involve 1. Active listening to understand the client's motivations and concerns. 2. Assessing the client's current nutritional knowledge and behaviors. 3. Providing accurate, evidence-based information about nutrition and debunking misinformation in a supportive manner. 4. Identifying when a client's needs extend beyond the coach's scope of practice and making appropriate referrals to registered dietitians, physicians, or mental health professionals. 5. Focusing on building sustainable healthy habits rather than promoting quick fixes. Question 17. The risk matrix shows a client expressing interest in incorporating more physical activity into their routine, specifically mentioning a desire to improve cardiovascular health and muscle tone. The client has a history of mild hypertension, which is currently managed with medication. As a health and wellness coach, how should you best guide this client regarding exercise types? Option A. Provide a detailed, personalized strength training workout plan with specific weights and repetitions, and a daily running schedule without consulting their physician. Option B. Advise the client that their hypertension makes it too risky to engage in any strenuous exercise and suggest focusing solely on light stretching and mindfulness techniques. Option C. Discuss the general benefits of aerobic exercise for cardiovascular health and strength training for muscle tone, emphasizing the importance of consulting their physician before starting any new exercise program to ensure it is safe and appropriate for their condition. Option D. Recommend a specific high-intensity interval training HIIT program, as it is highly effective for both cardiovascular improvement and muscle building, and suggest they start immediately to see rapid results. Correct answer is C. Discuss the general benefits of aerobic exercise for cardiovascular health and strength training for muscle tone, emphasizing the importance of consulting their physician before starting any new exercise program to ensure it is safe and appropriate for their condition. Explanation. This scenario is professionally challenging because it requires the health and wellness coach to balance client autonomy with the need for evidence-based recommendation, all while operating within the scope of practice defined by the Health and Wellness Coach Certifying Examination, HWCCE, regulatory framework. The coach must avoid overstepping into medical advice or prescribing specific exercise regimens without proper qualifications, adhering strictly to the HWCCE guidelines on scope and ethical conduct. The correct approach represents best professional practice because it prioritizes a holistic, client-centered strategy that aligns with the HWCCE emphasis on empowering clients to make informed decisions. By discussing the general benefits of different exercise types and encouraging consultation with healthcare professionals for personalized plans, the coach respects the client agency and ensures safety. This approach upholds the ethical principle of do no harm by not providing unqualified medical or exercise prescription advice, and it aligns with the HWCCE mandate to promote well-being through education and support, not direct medical intervention. An incorrect approach that focuses solely on recommending a specific type of exercise without considering the client's individual health status or consulting with a medical professional represents a significant regulatory and ethical failure. This could be construed as practicing outside the scope of a health and wellness coach, potentially leading to adverse health outcomes for the client and violating the HWCCE guidelines on professional boundaries and the need for interdisciplinary collaboration. Another incorrect approach that dismisses the client's interest in a particular exercise type without a valid, client-specific reason or without offering alternatives, demonstrates a lack of client-centeredness and may not align with the HWCCE principles of motivational interviewing and client empowerment. Professionals should employ a decision-making process that begins with understanding the client's goals and current situation. This involves active listening and open-ended questioning to gather information. Next, the coach should assess their own scope of practice and identify any limitations. When exercise recommendations are involved, the paramount consideration is client safety and the need for appropriate professional consultation. The coach's role is to educate, motivate, and support, facilitating the client's journey towards health and wellness by connecting them with the right resources, which may include healthcare providers for specific medical or exercise advice. Question 18. The audit findings indicate that a health and wellness coach has consistently applied the principles of the transtheoretical model stages of change to all clients, regardless of their individual circumstances or reported challenges. The coach believes this model provides a comprehensive framework for understanding and facilitating behavior change. Considering the diverse nature of health behaviors and individual client experiences, which of the following approaches best reflects a sophisticated and ethically sound application of health behavior change theories in coaching practice? Option A. Primarily utilizing motivational interviewing techniques without a strong theoretical grounding in behavior change, assuming that skillful questioning will inherently lead to desired outcomes. Option B. Focusing exclusively on the transtheoretical model, as it offers a clear, step-by-step process that is easy for both the coach and the client to follow. Option C. Prioritizing the coach's personal preference for a particular theoretical model that has yielded positive results in past cases, even if it doesn't fully align with the current client's expressed needs. Option D. Integrating principles from multiple health behavior change theories, such as self-determination theory and social cognitive theory, to tailor interventions based on the client's specific stage of change, motivational drivers, and perceived self-efficacy. The correct answer is D. Integrating principles from multiple health behavior change theories, such as self-determination theory and social cognitive theory, to tailor interventions based on the client's specific stage of change, motivational drivers, and perceived self-efficacy. Explanation. This scenario presents a professional challenge because the health and wellness coach must navigate the ethical imperative to support client autonomy and self-efficacy, while also adhering to the principles of evidence-based practice and the scope of their certification. The coach's audit findings suggest a potential over-reliance on a single theoretical framework, which could inadvertently limit the client's engagement and progress. The core of the challenge lies in adapting theoretical approaches to the individual client's unique needs and readiness for change, rather than rigidly applying a predetermined model. The correct approach represents best professional practice because it prioritizes a client-centered methodology that integrates multiple health behavior change theories. This allows the coach to tailor interventions to the client's specific stage of change, motivational drivers, and perceived barriers, as outlined by models like the transtheoretical model, stages of change, and self-determination theory. By drawing from various theoretical perspectives, the coach can offer a more comprehensive and adaptable support system, fostering greater client buy-in and sustainable behavior modification. This aligns with the ethical guidelines of the Health and Wellness Coach Certifying Examination, HWCCE, which emphasize client well-being and the application of evidence-informed strategies. An incorrect approach that relies solely on the transtheoretical model without considering other factors would be professionally unacceptable. This could lead to misinterpreting a client's readiness for change or applying interventions that are not aligned with their intrinsic motivation, potentially causing frustration and disengagement. This fails to meet the HWCCE expectation of a holistic and adaptable coaching practice. Another incorrect approach that focuses exclusively on motivational interviewing techniques without a foundational understanding of underlying behavior change principles would also be ethically problematic. While motivational interviewing is a valuable tool, its effectiveness is amplified when grounded in theories that explain why certain approaches work. Without this theoretical underpinning, the coach might employ techniques superficially, leading to less impactful or even counterproductive outcomes, violating the HWCCE emphasis on evidence-based practice. A third incorrect approach that prioritizes the coach's preferred theoretical model over the client's expressed needs and preferences would be a significant ethical failure. This demonstrates a lack of client-centeredness and could undermine the coaching relationship, as the client may feel unheard or misunderstood. The HWCCE mandates that coaches respect client autonomy and tailor their approach to individual circumstances. The professional decision-making process for similar situations should involve a continuous assessment of the client's progress, feedback, and evolving needs. Coaches should maintain a broad understanding of various health behavior change theories and be prepared to integrate them flexibly. This requires ongoing professional development, critical self-reflection on coaching practices, and a commitment to prioritizing the client's unique journey over rigid adherence to any single theoretical framework. Question 19. Process analysis reveals that a client expresses a desire to eat healthier. As a health and wellness coach, which of the following approaches best facilitates the development of a SMART goal aligned with regulatory and ethical coaching standards? Option A. Collaboratively explore with the client what eating healthier specifically means to them. Identify measurable ways to track dietary changes. Discuss realistic adjustments they can make. Ensure these changes align with their overall wellness objectives, and establish a timeframe for implementing and reviewing these changes. Option B. Define eating healthier as eliminating all processed foods and sugar within 1 week, as this is a clear and impactful change. Option C. Encourage the client to simply try their best to make better food choices each day without setting specific targets or a timeline, trusting that they will naturally improve over time. Option D. Immediately suggest a detailed meal plan with specific calorie targets and a strict daily schedule for meals, as this is the most direct way to ensure healthier eating. The correct answer is A. Collaboratively explore with the client what eating healthier specifically means to them. Identify measurable ways to track dietary changes. Discuss realistic adjustments they can make. Ensure these changes align with their overall wellness objectives, and establish a timeframe for implementing and reviewing these changes. Explanation. This scenario is professionally challenging because it requires the health and wellness coach to balance client autonomy with the ethical imperative to guide clients toward achievable and beneficial goals. The challenge lies in ensuring that the client's perceived needs are translated into actionable, measurable steps that align with their overall well-being, without imposing the coach's own agenda or creating unrealistic expectations. Careful judgment is required to foster client empowerment while maintaining professional boundaries and adhering to ethical coaching standards. The correct approach represents best professional practice because it directly applies the SMART goal-setting framework, which is a widely accepted and evidence-based methodology in coaching. This approach ensures that goals are specific, measurable, achievable, relevant, and time-bound. By collaboratively developing these elements with the client, the coach facilitates a deeper understanding of the goal's feasibility and the steps required for success. This process respects client self-determination, promotes accountability, and increases the likelihood of positive outcomes, all of which are foundational to ethical and effective health and wellness coaching. An incorrect approach that focuses solely on the client's immediate desire without exploring the how, or when fails to establish a clear path to success. This can lead to frustration, a lack of progress, and a diminished sense of accomplishment for the client, potentially undermining the coaching relationship and the client's motivation. Ethically, this approach could be seen as a failure to provide adequate guidance and support, potentially leading to a situation where the client feels set up for failure. Another incorrect approach that involves the coach dictating the specific actions and timelines for the client, rather than co-creating them, infringes upon client autonomy. This can foster dependency rather than empowerment, and may lead to goals that are not truly aligned with the client's values or lifestyle, making them unsustainable. This approach risks overstepping professional boundaries and can be perceived as prescriptive rather than facilitative, which is contrary to the principles of client-centered coaching. A third incorrect approach that prioritizes a vague aspiration over concrete steps neglects the measurable and time-bound aspects of SMART goals. While the aspiration might be relevant, without clear metrics and deadlines, it becomes difficult to track progress or determine when the goal has been achieved. This can lead to a lack of accountability and a feeling of stagnation for the client, hindering their ability to experience tangible improvements in their well-being. The professional decision-making process for similar situations involves a commitment to a client-centered, collaborative approach. Professionals should first actively listen to and understand the client's aspirations. Then, they should guide the client through the SMART framework, asking open-ended questions to explore the specificity, measurability, achievability, relevance, and time-bound nature of their goals. This process empowers the client to take ownership of their goals while ensuring they are well-defined and actionable, fostering a supportive and effective coaching relationship. Question 20. Operational review demonstrates a client expresses a strong desire to eliminate all carbohydrates from their diet, believing this is the most effective path to rapid weight loss and improved energy. As a health and wellness coach, what is the most appropriate initial risk assessment and response? Option A. Advise the client that their understanding of nutrition is incorrect and that eliminating carbohydrates is a dangerous approach without further explanation. Option B. Focus solely on the client's weight loss goal and provide strategies for calorie restriction without addressing the specific macronutrient request. Option C. Educate the client on the essential role of carbohydrates as an energy source. Discuss the potential risks of complete carbohydrate elimination and explore the client's motivations and understanding of balanced nutrition. Option D. Immediately create a detailed meal plan that strictly excludes all forms of carbohydrates to support the client's stated goal. The correct answer is C. Educate the client on the essential role of carbohydrates as an energy source, discuss the potential risks of complete carbohydrate elimination, and explore the client's motivations and understanding of balanced nutrition. Explanation. Scenario analysis. A health and wellness coach is presented with a client who expresses a strong desire to eliminate all carbohydrates from their diet, citing anecdotal evidence of rapid weight loss. This scenario is professionally challenging because it requires the coach to balance client autonomy and their stated goals with the coach's ethical and professional responsibility to promote evidence-based, safe, and sustainable health practices. The coach must assess the client's understanding of nutrition, the potential risks of extreme dietary restrictions, and the importance of macronutrient balance without overstepping professional boundaries or providing medical advice. Correct approach analysis. The correct approach involves a thorough risk assessment of the client's proposed dietary change. This includes understanding the client's motivations, current health status, and potential nutritional deficiencies that could arise from eliminating an entire macronutrient group. The coach should then educate the client on the fundamental role of carbohydrates as a primary energy source, the different types of carbohydrates, complex vs. simple, and the importance of a balanced macronutrient intake for overall health and well-being. This approach aligns with the Health and Wellness Coach Certifying Examination, HWCCE guidelines, which emphasize evidence-based practice and client education within the scope of coaching. It prioritizes client safety and long-term health by guiding them toward a sustainable and nutritionally sound approach, rather than simply endorsing an extreme and potentially harmful dietary fad. Incorrect approaches analysis. One incorrect approach involves immediately agreeing to the client's request to eliminate all carbohydrates and providing a meal plan that excludes them. This fails to conduct a proper risk assessment and bypasses the coach's responsibility to educate the client on basic nutrition principles. It could lead to nutrient deficiencies, energy depletion, and other adverse health effects, violating the ethical principle of do no harm. Furthermore, it may be construed as providing dietary advice beyond the scope of a health and wellness coach, potentially bordering on medical advice without appropriate qualifications. Another incorrect approach is to dismiss the client's request outright and tell them they are wrong without further exploration or education. While the client's request may be based on misinformation, a dismissive attitude can alienate the client, damage the coaching relationship, and prevent the coach from addressing the underlying reasons for the client's desire for such an extreme diet. This approach lacks empathy and fails to uphold the coaching principle of client-centered support. A third incorrect approach is to focus solely on the client's stated goal of rapid weight loss without considering the nutritional implications. While weight management is a common client goal, achieving it through extreme dietary measures that compromise overall health is not a sustainable or ethical coaching practice. This approach neglects the broader context of health and wellness and prioritizes a short-term outcome over long-term well-being, which is contrary to the holistic principles of health and wellness coaching. Professional reasoning. When faced with a client proposing an extreme dietary change, a health and wellness coach should employ a structured decision-making process. This begins with active listening to understand the client's motivations and concerns. Next, The coach must assess the potential risks and benefits of the proposed change, drawing upon their knowledge of basic nutrition principles and evidence-based practices. Education is a key component, empowering the client with accurate information to make informed decisions. The coach should then collaboratively develop a plan that aligns with the client's goals while prioritizing safety, sustainability, and overall health. If the client's request poses significant health risks or falls outside the coach's scope of practice, the coach must ethically refer the client to appropriate healthcare professionals, such as a registered dietitian or physician.